We're at the Regional World Health Summit 2025 at Bharat Mandapam, where the G20 was hosted. With me here, I have Ravi Bhatnagar from Reckitt. We've been working together, Ravi, for over 10 years now. The NDTV Dettol Banega Swasth India campaign is in the 11th year. We've come a long way, Ravi, when it comes to, working, when it comes to together. But having the World Health Summit here in Delhi, the regional one, what are your thoughts on something as critical and important as this?
A range of things are getting discussed, from the rural health to urban health to discussions on the role of the community-based organizations, role of the NGOs, how the private-public partnerships can happen, and one of the very, very important discussion about the media houses as a fourth important pillar of democracy and their role in the public health. So I'm very happy. Like we had the first panel in the morning. There is a lot of learning from the Dettol Banega Swasth India. Other programs are also looking in India. Like you have the malaria program, you have the dengue program, you have the tuberculosis program. People have come forward and requested us, what are the learnings? So how they can do some magic like what Dettol and NDTV could do together. And many of them actually realize the work, what we have been doing on hygiene is a foundational work. And we rightly say hygiene is the foundation of good health. Even in the disease like tuberculosis, even the disease like malaria prevention, dengue prevention, when you see it, upstream, it's very important to, have wash as a component, which is water and sanitation, and especially the hand hygiene.
The whole conversation today, and as we see through the World Health Summit, has been on the increase in the number of diseases. Even if you look at like dengue, initially it's moved from urban to rural. It's gone across, or malaria, new diseases. What are your thoughts on that? Because on the panel, that was being discussed as well.
There are three portions or the parts I want to discuss. The first is basically a framework, which is a prevention framework. Second is the promotion of good health framework, and third is the treatment framework. There will be a lot of discussions today about the role of the ICMR, the role of the Government of India, the role of rolling out of these interventions on ground, the availability of the vaccine on dengue in more than 30 countries now. So, but everyone realized one thing, like the prevention is the key, and how the right information actually goes, and the role of the doctor community, role of the civil society, role of the new moms. And how we were actually discussing today on the first panel about earlier it was just said it's for the vulnerable populations like the elderly, but it's very important, which came from today's discussion about the role of the even the interventions with the kids, how important they are. And there are a lot of sources, the fresh water when the dengue actually breeds. So under the wash component, it's very important, like water disposal should be made one of the top priorities. And we also discussed about the antimicrobial resistance, and we discussed about the role of hand wash also. And the third important component what we are talking about is the treatment part, how the hospitals can be more prepared, but that's the most costliest affair. And two things are very, very important as the key takeouts. One is investing in the prevention, and second is whenever the inoculation or the vaccination is available, making sure India is vaccinated and vaccinated well on time. I'm very hopeful the vaccination will come soon in India also, as ICMR and other health bodies are working. And under the leadership of our current health minister, Mr. Nadda, we have achieved a lot, but there is still a lot of things which have to be done.
Lastly, Ravi, you've really put that well when we talk about Viksit Bharat at 2047. Of course, when we today, even the panelists spoke that 2030 SDGs, we are on track. But your last words on achieving going towards 2047.
So one of the very interesting work what in India Niti Aayog, which is a think tank for India, Government of India has been working on identifying the aspirational blocks. Earlier they identified the aspirational districts. Now you have a list of 500 aspirational blocks across India. I personally never thought in the states like Punjab also we will be having an aspirational district or an aspirational block. When I looked at the data is super relevant. and it's the time, and it is the time to actually invest in the aspirational blocks in India, so that we can reverse and halt many things which impact the public health. We can improve the human development index of all these places, and best part is there are now trackers available with the government, but the success will only happen when the community is also engaged in that deeply, and there will be a meaningful engagement. Government has made a very important and interesting enabling environment to make sure whatsoever is thought at the central level is decentralized, and the results go up in a very similar way, like how you have Swachh Sarvekshan, where you have the ranking of the cities. In the same way for the big states, small states, northeastern states, now you have the ranking of the various blocks of the various states, which is a leadership board. And carrots work a lot, but also sometimes sticks also are needed. But that will only come, the sticks only come when things are not moving well. Under the able leadership of our Honorable Prime Minister and Honorable Health Minister Mr. Nadda, I'm very sure we will be seeing an India which is moving swiftly towards Viksit Bharat 47.
World Health Summit is very important. This is a regional meeting and very important at this point of time, where we can discuss, we can plan and bring everyone together to focus on SDG, because now 5 years remain and we are very much on track.
Summit has provided a platform where the multi-stakeholders, whether it's the research institutions, whether it's the private partners or the NGOs, we are sitting together how they can work together so that we can find out better solutions for the management of different diseases, including the dengue.
Public health is a very important component of Human Development Index. Therefore, we have to pay attention, and this summit will focus and highlight on some of the areas where we need a lot of attention.